Hi everyone, I'm Winnie and I'm the pelvic floor physiotherapist of Movement Laboratory and Papaya Clinic. If you're watching this video, I think your physiotherapist might have suggested pessary fitting to help you with your incontinence symptoms or maybe your sense of heaviness and bulging. I want to give you a bit more information on pessary itself and how it helps so that you can make an informed decision of whether pessary is for you or not. And if you do decide that pessary is for you, highly suggest you to book a consult and allow for at least 30 minutes for fitting. Because sometimes with the fitting, we might have to fit a couple of different models of pessaries. It's like fitting a bra. It comes in many different shapes and sizes. So we'll show you a little bit in here today, but also to answer a lot of the questions that we often get asked by patients. So if you have the following symptoms, you might be a good candidate for pessary. So one is if you're stress urinary incontinence. So when you are laughing, jumping, sneezing, you are leaking. Be it droplets of urine or maybe a gush of urine. If it's a gush of urine, then definitely I would highly suggest pessary. But if it's droplets, you're also a suitable candidate. Two is if you have a sense of bulging or a sense of heaviness in your vagina. And normally we classify it as pelvic organ prolapse, which means that the integrity of the connective tissue inside vaginal walls is a bit compromised. And that could be because of childbirth, it could be because of your hormonal levels are a bit low, it could be perimenopause, a combination of things, or it could be consistent straining when you're defecating, or activity if you're lifting really, really heavy weights, or if you're an Olympic weightlifter. So we call that pelvic organ prolapse. They normally get worse in the second half of the day. The longer that you're upright during the day, the more that you feel the symptoms. When you sleep, it sort of zip and goes back up, and then the next day you feel better. So that is a very classic prolapse symptoms. So if you have either or, so incontinence or sense of heaviness, pessary is highly recommended for many reasons, which I'll go through in the video with you. If you do not go for pessary, first line of management is always pelvic floor muscle training to address the tissue. So we want to bulk up the tissue. We want the tissue to have a better contraction and relaxation, so better function, and that you can hold, you have the endurance, correct timing, so that whenever you need it to shut your urethra, you can shut it in a very effective way. So that is pelvic floor muscle training. However, pelvic floor muscle training only helps around 60% of the population that have incontinence, and the other 40% normally happens because there is actually an anatomical contribution to it. So I'll explain here. And all of this will make sense in a minute. Your physio has probably already explained it to you, so I'll keep it brief. You can see that there's a bladder and there's a urethra, uterus, vagina, and so your vaginal wall is here. You have the anterior vaginal wall and the posterior vaginal wall, and then the top wall. And then you have your rectum, where your stool collects in here, and if you need to defecate, your anal sphincter is going to relax, allowing the stool to come out through here. Pubic bone is in the front, coccyx is at the back. So where your pelvic floor sits, your pelvic floor is attached from the pubic bone all the way to the coccyx, and it's like a U-shaped structure around. So when you contract your pelvic floor, it brings your anus to your vagina, to your urethra, and that action is what closes the urethra. If, let's say, your pelvic is weak, you can't contract, or it's not bulky enough, and so when you contract, it actually doesn't generate the pressure to close your urethra, or if you're a little bit hypermobile, which means that everything is soft, it's floppy, and so when your pelvic floor is contracting, instead of actually closing, it's just flopping things around. And that can happen. People who are hypermobile is normally genetic. So it is that your collagen is a bit less. And if you look at the skin, so I'm a bit hypermobile, you can see I can have a lot of skin lift from my palm, back of the palm, or in the neck as well. So these are normally the things that we ask you just to have a brief look at whether you're hypermobile or not. Sometimes it's quite hard because you have nothing to compare it with. You don't know, like this, you're comparing yourself to yourself. But as physios, we touch connective tissue every single day. It's really easy for us to separate the labia and know straight away you're hypermobile, or to ask you to do a skin lift and see that you're hypermobile. There are different hypermobility tests out there, which I'm not going to go through today, to test that if you are hypermobile or not. But normally if you are, you might also have other symptoms such as slower digestion, bloating, because your connective tissue is not effective in pumping food forward in the digestive mechanism. Or maybe you are harder to build bulk and muscle tone, or maybe your joints are hypermobile. So you might have like a really hyperextended elbow, or you might be double jointed, or you might be able to bend your thumb back all the way and touch your wrist. that is hypermobility. But hypermobility normally affects the whole body and the connective tissue. And so definitely every single tissue in here as well. Yeah. So for example, your urethra, your vagina, your vaginal walls, the muscle tone, everything around here. So if you're hypermobile, it makes it harder for your pelvic floor muscle to do the things that is necessary to close the bladder wall. So this is where Pessary is really good to help you with it. Let's go into how Pessary might help. As I said, it comes in many different shapes and sizes. The two main pessaries that you think about is one that is with suction and one that is without suction. So normally we like to begin with a pessary that is just the easiest to fit, the easiest to manage, which is a ring pessary. So I'll show you. These are all the different pessary types, and there are a lot more out there. In the clinic, we like to normally use a ring or a Gellhorn or a cube. So you can see a ring pessary, it doesn't have a suction. Like for example, this one has suction, and a Gellhorn you can't see very good in here, but normally there's suction. It's like a concave surface, so that when you go in, it suctions onto the wall. So these are the pessary that have more support for the walls, and while the ring have less support. But we want to normally fit the pessary that gives you just enough support that is easiest to manage. So a ring is really good, for example, because you don't have to take it out. You can keep it in for 6 months, and by 6 months you take it out, give it a wash, put it back in. It is very much set and forget, whereas those with a suction, normally you have to take it out every fortnight. And if you have sex, you probably want to take it out. Some people can have sex with a Gellhorn and they say it doesn't really affect them, but it's very much personal preference. You can put a tampon or you can use a menstrual cup. But if, let's say, you fit a cube and things just feel a bit much, like there's a lot of things inside the vagina, then take out the cube and put the menstrual cup in. So different management for different pessaries. Now, how a pessary help, if you look at this diagram, I know that you need to change your orientation a little bit because the previous anatomy diagram, we have the pubic bone in the front, and in here we have the pubic bone in on the right side, left side, whatever it is. So you can see, same thing, right? Uterus, cervix, this is where the pessary is going to sit. This is a bladder, and this is the urethra. So what it does is, as you can see, we fit the pessary, you put it all the way below the cervix. So there's a front wall, there's a back wall. The pessary goes up and it holds the wall still. So if you want to return back to running, or you want to increase your physical activity, or you normally are a bit low tone, you're fatigued, and the walls are starting to come down, you know that there's peace of mind that the pessary is going to hold the wall still. It doesn't come down and give you that sense of bulging or heaviness sensation. The other thing is, because the pessary is sitting right there, remember how I said that your pelvic floor goes from the front all the way to the back, and when it contracts, it brings all the tissue forward and closes your urethra. So if you can imagine that you are a little bit floppy, or maybe you have low in estrogen and things are just feeling a bit wider, softer, there's not as much bulk in your pelvic floor or your vaginal wall, what happens is the pessary is there to counteract that. So when I contract, the pessary is now helping to close the urethra. So because of that, pessary does help with reducing incontinence symptoms and a sense of heaviness or bulging. Sometimes we fit pessary for a preventative purpose. So maybe we assess you in the clinic in your pelvic floor exam, and we see that anatomically the tissue does come down. So you might be lying down there, or you might be standing. We ask you to cough or to bear down, and we see the tissue does move, but you don't have symptoms yet. We want to prevent symptoms from happening, and so we do a preventative pessary. We'll put a pessary in for around 12 months. It gives you time to work on your pelvic floor muscle to make sure it's as effective and as bulky as possible. And so by 12 months, we'll wean off the pessary and see if you have symptoms or not. So that's really good, and it's a very common practice in postpartum period that it prevents symptoms from coming on. If you don't have symptoms, it doesn't mean that you will never have symptoms. It might mean that symptoms come a bit later if you are a little bit more low tone, or if you are reaching the perimenopause stage, your vaginal walls are a little bit thinner. That's when symptoms come. So we normally see patients either acutely postpartum because they're leaking and they feel heavy, or they are perimenopause and now symptoms are starting to come. The prolapse might have been there for ages. It just is asymptomatic. Okay. And normally fit the pessary, it takes around 30 minutes or so. We might try different shapes and sizes, and then you go away for 2 weeks, making sure that it doesn't fall out. So you don't want it to fall out when you're just walking around. You also don't want it to fall out when you're defecating or coughing or laughing or sneezing. So we look at whether it can stay put inside and whether it reduces symptoms. Normally, give it a couple of weeks to evaluate how much it reduces your symptoms. If it reduces symptoms to a significant level, then you can just keep the pessary in. And then we check you out at 6 months to make sure everything is okay. And then 12 months, we change the pessary. That is manufacturer guidelines. If, let's say, it slips out, then we need to refit another model. Or if we see spotting or increased discharge or frailty of the skin, then we might ask you to do something to the vaginal wall and the tissue first. It might be vaginal moisturizer. It might be putting hyaluronic acid pessary in or estrogen cream to thicken up the tissues before we put the pessary in. So there are different things that we do, and we'll talk a little bit more in the fitting appointment, okay? So what I want you to do now is just to have a think whether you would like to fit a pessary. This is excellent material that you can go into the Papaya website, go into the resources. Under resources, free resources, if you scroll down, there is a really good guideline for stress urinary incontinence and pelvic organ prolapse. These are from the consumer guidelines, the Australian government consumer guidelines. So if you open that, it is actually give you a really detailed summary of what we have talked about and what your physios have talked about with you as well. And it also shows you the different, I think is this one. It talks about surgery as well, but if we're having this chat, most likely you're not the candidate for this. Actually, in the pelvic organ prolapse guide, it talks about pessary. There you go. So it shows you all the different types of pessaries and how it helps, but it also shows you if you have a bit of prolapse as well. It also shows you the diagram in here. So the different types of vaginal prolapse. I hope your physio have gone through this with you, so I'm not going to go through it here, but pessary really helps for grade 1 and grade 2 pelvic organ prolapse. Sometimes we fit pessary for grade 3, but normally at grade 3, when the vaginal wall the tissue is already outside, it might make it a bit harder for you to hold the pessary. But it is all try and error, and it might be a much better way to manage your symptoms instead of going for surgery. So those are the patients that we fit pessary for. So have a think about this and get back to your physio on whether you would like to do the pessary or not. At the moment in Papaya Clinic, I'm the only one who fits pessary, so you might probably come to get to meet me if you are deciding to fit pessary, and then we'll refer you back into your physio to do your management afterwards. Make sure that when you fit a pessary, it doesn't mean that you don't do your pelvic floor muscle training. You still need to do it. This is really a complementary thing to your pelvic floor muscle training. Pelvic floor exercises are always a must, and I highly recommend you to really invest your time and commitment to at least do it continuously for 3 months to see how far it can take you in terms of reducing your symptoms. Cool. Nice to meet you. I'll see you in clinic. Bye.